specifically around how we do this safely. And it's a global collaboration. There's a large number of scientists that are helping to advise us on this. We have our second meeting this week, and that is something that we have specifically pulled together for this, because it is such a complex issue and it is such an important issue for all of us.
Thank you very much, Drs. Ryan and Drs. Van Kerkhove. Our next question comes from Catalan, from Nazare Romero, from the Catalan News Agency. Nazare, please unmute yourself and go ahead.
Hello, can you hear me?
Very well. Please go ahead.
So, thank you very much for taking my question. I'll ask in Spanish, if I may. En los últimos días hemos visto cómo se han detectado nuevos brotes en Europa, por ejemplo en España, y quería saber si les preocupan estos nuevos brotes en Europa, donde la situación parecía estar más bajo control que en otros sitios del mundo. Y también quería saber cuáles son sus recomendaciones cuando se detectan brotes locales, si recomiendan medidas de confinamiento o cualquier otra medida es mejor. Muchas gracias.
So thank you for the question. I think this is exactly what the Director General was speaking to today. And we spoke at our last press conference about this, and that in many countries that have been able to suppress transmission, there is always the possibility of resurgence. And what is really important is that the countries that have used this time and have spent the time to build this public health infrastructure, the workforce in place, the surveillance in place, the strategies in place, to act fast when there is an upsurge in cases, whether it's a small cluster or whether it's something that has an outbreak that has started. The opportunity is to act fast and to apply the same comprehensive approach, informing your public, saying where this virus is, what are we doing to suppress it, what role you can play as an individual, what role we are playing as leaders to be able to bring these outbreaks under control. And I think that if the infrastructure is in place, if that workforce is in place to find cases, test cases, isolate cases, carry out contact tracing, quarantining contacts, and putting in place perhaps some restrictive measures in a localized area. So not go into the full-on nationwide lockdown, but to really apply measures at the lowest administrative level as possible to help support the outbreak response. That is something that we see going forward, where that can be done in a data-driven way. So there are opportunities to suppress these outbreaks, these resurgence, and these pockets of activity very, very quickly. And we're seeing a number of countries really be successful in doing that very quickly. But it takes a surveillance system in place to rapidly identify the cases so that you know when you need and where you need to act fast.
Thank you very much, Dr.